Prenatal vitamins are one of the most important parts of having a healthy pregnancy. Today we'll be talking about everything you need to know about prenatal vitamins and how to find the right one for you. So click those like and subscribe buttons and stay with us. Prenatal vitamins are multivitamins designed with pregnancy-required nutrients. The ideal time to start these is 3 months before you even start to try to get pregnant or start fertility treatments. Just remember, expensive prenatal vitamins are not always better, and it's very important to check if all the required nutrients are in your prenatal vitamin. A good example is calcium. There's usually not enough of the recommended amount of calcium in a prenatal vitamin. You need to know your serving size because even though you get a prenatal vitamin, it doesn't mean that one pill is the whole amount of the nutrients required. Some will require you to take 6 pills a day, for example. And you want to avoid gummies. Gummies are often missing nutrients, including iron. Also avoid herbal supplements because these aren't recommended and they aren't monitored by the FDA. Folic acid is required for a healthy pregnancy. You need anywhere from 400 to 800 micrograms every day. But if you have any risk factors for a baby developing neural tube defects, your doctor may tell you to take 4,000 micrograms of folic acid every day. Folic acid helps to prevent neural tube defects. This includes abnormalities with the brain and spine. It also can prevent cleft lip and cleft palate and certain heart defects. Iron is required at 27 milligrams per day. This is a mineral that's very important in making hemoglobin. Hemoglobin is the protein in your blood that carries oxygen to your body. During pregnancy, you need twice as much iron as you normally do because you have more blood that's required to carry the same oxygen to your baby. Your baby also uses some of that iron to make their own blood. Deficiency in iron leads to infection, fatigue, anemia, preterm birth, and low birth weight. For a healthy pregnancy, 1,000 milligrams of calcium per day is recommended. This is a mineral and it helps to prevent blood clots. It also helps to develop your baby's bones, teeth, heart muscle, and nerves. If you don't get enough calcium, your body will strip the calcium from your bones, leading to osteoporosis, which is why it's so important for you to take 1,000 milligrams per day. Vitamin D is also required, and you need 600 to 1,000 international units of vitamin D per day. This protects you from infection by boosting your immune system. It also helps your baby's bone, teeth, and skin grow, which may help to also decrease your risk of preeclampsia when you take your vitamin D. Please remember to hit the like and subscribe buttons so you can get our latest content. Let's talk about iodine. Your prenatal vitamin should have approximately 220 micrograms daily contained within it. Iodine is essential for helping your thyroid make thyroid hormone. And thyroid hormone is used to use and store energy from food. It also helps your baby's brain and nervous system to develop. And deficiency in iodine can lead to miscarriage, stillbirth, deafness in the baby, stunted growth, or even severe cognitive disability. Vitamin C should be at least 85 milligrams per day. This helps you absorb iron better. It also boosts your immune system. And for your baby, it develops their cartilage, tendons, bones, and skin. DHA is also known as omega-3 fatty acids, and this is a fat that helps with the growth and development of your baby. ACOG recommends 300 milligrams of DHA, but this is not normally provided in a prenatal vitamin, and you can only have fish 2 to 3 times per week, so it's important to supplement this. This DHA helps with the brain and eye development of your baby, including the retina development. It also lowers your risk of preterm birth and having a low birth weight baby. Choline is required at 450 milligrams per day. Now, choline is under-recognized for its importance, but is an extremely important vitamin. It helps with the brain and spine development of your baby, as well as baby's long-term cognition. It reduces the risk of neural tube defects, and it lowers baby's cortisol, which reduces their lifetime risk of stress-related diseases. It also helps reduce pregnancy complications, including issues with the liver and placenta. Don't over-supplement when taking prenatal vitamins. You want to make sure you take them as directed on the bottle or by your healthcare provider. You can actually take too much of certain vitamins. An example is vitamin A, and this can cause birth defects. You want to make sure your prenatal vitamin has approximately 11 milligrams of zinc per day. This is an immune system booster and will help decrease your risk of getting an infection. It also helps your baby's nervous system to develop. Thiamine, which is vitamin B1, and riboflavin, which is vitamin B2, both help with energy and nervous system development. And B2 also helps the eyesight and the skin. Niacin, which is vitamin B3, you need about 18 milligrams per day. This helps your baby's skin, nerves, and digestion. Pyroxidine, vitamin B6, you need about 1.9 milligrams per day. This helps to form your baby's red blood cells, and it also will help you with morning sickness. B12 is essential for a healthy pregnancy. You want approximately 2.6 micrograms per day. This helps with DNA synthesis and prevents neural tube defects. Vitamin E, you're looking for about 15 milligrams per day, and this helps with developing red blood cells and muscles. One of the things you should be aware of is that the Federal Drug and Food Administration lowered biotin requirements to 30 micrograms in 2020. There are some things you need to know about prenatal vitamins. For starters, they may cause nausea. Vitamin B6 and Unisom can help with this, and also taking your prenatal vitamin at night and with food can also help. Many of them are large in size, so if you can't swallow a large pill, you want to find one that's smaller or ask your healthcare provider for a prescription liquid or chewable. Many will cause constipation, so eat fiber and drink 64 to 96 ounces of water per day. You can also exercise and use a stool softener to combat constipation. And finally, remember, food is best. This is how our bodies were meant to absorb our nutrients. Eat healthy and make sure you include at least 60 grams of protein every day. I hope this video has helped you learn everything you need to know about prenatal vitamins and why they are so important for a healthy pregnancy. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe button so you can get our latest information in pregnancy, labor, and early childhood parenting. Share this video with your friends and family and follow us on Facebook and Instagram for additional content. We will link those into the description below. Thank you so much for joining us at the Maternity Mentor.